name is Benjamin Chaffee. I'm a faculty member at the University of California, San Francisco. I'm also a Berkeley alum. Go Bears. In my research, my team and I try to better understand how high school students make decisions about tobacco and nicotine use so that we can try to prevent their use in the future. As an instructor, I help our UCSF dental students become better equipped to help their patients live tobacco and nicotine-free. If you're listening to this, there's a good chance that you're interested in quitting tobacco use. Congratulations. Wanting to get there is the first step to becoming a former tobacco user for life. There are many reasons to want to quit tobacco use, but the motivation has to come from you. It's not easy. Quitting nicotine use can be extremely difficult. Failing in one attempt is not a failure. It's just one step closer to achieving your goal. Emphasize the positive, and remember, you can get there. And you don't have to do it alone. You can lean on help from a healthcare provider. You can use medications that make your chances of success much greater. Lean on your friends and your family to support you and achieve your goals. Because there are 40 million Americans who have quit smoking. It wasn't easy for them, but you can get there and be one of the 40 million. Because there are so many benefits to quitting. The average price of a cigarette pack in California is about $8. Over a lifetime of cigarette smoking, that can add up quickly. $150,000 just in today's prices, just for buying the cigarettes. Think what you could do with that money. Quitting tobacco use has a tremendous benefit for the people around you and for the environment. Those cigarette filters don't in any way reduce meaningfully the risk of tobacco-related diseases, yet trillions of them are littered per year where they stay in the environment as pollution for decades. And of course, the largest benefit to quitting tobacco use are the benefits to your health, which can be seen in just a few weeks. After 2 weeks, you begin to breathe easier, your circulation improves, it becomes easier to walk and run and go upstairs. And those benefits increase as the weeks and the months and the years go by. For a young person who can quit tobacco smoking in their 20s, that can add 10 years of life expectancy. 10 years. Think back where you were 10 years before today. Imagine all the people that you met in that time, the places you went, the things you saw, the things you did. Try to put a value on those 10 years. That's what cigarette smoking takes away. That's what quitting can bring you back. It isn't easy. Nicotine is an extremely addictive substance. And there are two aspects to nicotine addiction or dependence. Part of that is physiological, the chemical changes in the ways that nicotine affects your brain. But some of that is also behavioral, just aspects of using tobacco and those behaviors being hard to stop. So a solid tobacco quit plan addresses both these aspects of nicotine dependence. The physiological changes that nicotine has on your bodies can be addressed by using medications to help you quit. Also, a good quit plan should address those behavioral modifications as well. Thinking about behavior, part of that is retraining the way that you think, affirming that commitment to being a former tobacco user, and thinking of yourself in that way, not someone who's struggling to quit, but someone who's proud to be a non-smoker. Give yourself positive thoughts. Work through mental imagery. Imagine when you're in that next situation where you're going to be tempted to use tobacco, think positively and rehearse how you'll respond and how you'll make your way through that challenge. There are also specific actions you can take to reduce the chances of relapse. Clear your home, your car, and your environment of tobacco products. Think about situations where you're more likely to smoke. Is it with certain people in certain places? Is it after you have a drink of alcohol? And be ready to address those situations with strategies to avoid lighting up. Maybe that's having a sugar-free or healthy snack. Maybe that's having your friends and your family support you. Let them know that you're trying to quit so they can help you get there. Medications can also make this much easier. Some of those medications, like nicotine gum, nicotine lozenge, and the nicotine patch, are available over the counter. In addition to two other forms of nicotine replacement therapies, the spray and the inhaler, which are available by prescription, these nicotine replacement drugs reduce withdrawal symptoms by providing a small dose of nicotine. Other medications, bupropion and varenicline, act in different ways without relying on nicotine. They reduce withdrawal symptoms and they reduce cravings, making it much easier to quit. A few words about vaping, which I'll preface by saying there are many things about vaping that as of today, we just don't know. We don't have the evidence to answer. Now, it's true that some people are able to quit smoking by switching over to vaping. But on the same hand, there are individuals for whom vaping makes quitting tobacco use much harder. On balance, we don't yet have the strong evidence to know whether or not electronic cigarettes and vaping work any better for adults to quit smoking than the gum, the patch, or going cold turkey. In fact, for some people, it may make things worse if that additional vaping gets added on top of an existing smoking habit. I will say this, for those individuals who are unwilling to consider other approaches to quit smoking, but want to make a quit attempt by trying vaping, well, the important part of that sentence is that you want to make a quit attempt. Just remember that being less harmful than smoking does not mean harm-free, and know that there are other alternatives to quit that do have strong evidence behind them. You can learn more about those approaches by contacting the California Smokers Helpline at 1-800-QUIT-NOW, 1-800-NO-BUTS, or by going to their website. Their trained counselors, completely for free, will work with you over the telephone or by text message to develop a personalized quit plan that works for you. Also, as a UC Berkeley student, you can always visit University Health Services to get the kind of support that you need, have your questions answered, to work through a quit plan that has the maximum chance of success for you. And with that, I'll say thank you very much to Breathe at Berkeley for inviting me to be part of this video series for the Great American Smokeout. Be healthy and go Bears. Thank you.